Imagine today is the big day. You are expecting your baby to arrive. Be it you're the mother or the father. You are thinking about who the baby will look like, what talents will be. Finally, the baby is here, but something is wrong. The doctor said there's an emergency and takes your baby for tests. Suddenly comes to mind that you did something wrong during your pregnancy. Did I drink too much alcohol? Did I take too many pills? There are so many questions running through your head. I'd like to tell you all about the negative effect that drinking and taking drugs can have on an unborn baby. A baby's time in the womb is critical for its development, not only for the time that it is in the womb, but for the rest of its life. What you choose to put in your body during your pregnancy will write your child's fate forever. First, let's look at how alcohol affects an unborn baby. Whether it be an occasional cup of wine to binge drinking every night, every action has a consequence on an unborn baby. According to the impact of drinking during pregnancy, drinking while pregnant can cause a baby to develop something called fetal alcohol syndrome. This usually occurs when a woman binge drinks during her pregnancy and has a lot of different effects on a baby. According to Women and Children's Health Network, babies born with FAS will have a number of physical changes to their head and face as well as their brain. Sometimes these changes are not easy to notice just by looking at them. Most babies with FAS are born with a small head or strange-looking facial features. I will now hand out a picture of what a baby with FAS looks like. As you can notice, the features are very different from what a healthy baby would look like. According to Healthline, the following are some of the effects FAS that can be seen in a child, but it differs from child to child. All the effects last a lifetime. They include brain damage, birth defects, social and behavior problems, developmental delay, low IQ, and poor health. Some of the effects are hard to see at birth and can't be seen until later in life. In conclusion, about your unborn baby and drinking alcohol, no amount of alcohol is safe during your pregnancy. Even the smallest sip is being shared with your baby and carries a high risk. Please think about the long-term effects of your baby when you're thinking about taking a sip. Next, let's take a look about how SSRIs, or antidepressants, affect your unborn baby. Taking antidepressants during your pregnancy can make your baby develop something called persistent pulmonary hypertension. According to DrugWatch.com, PPH is one of the most major effects of antidepressants on an unborn baby. This condition has a horrible effect on a newborn's heart and lungs. A newborn born with PPHN cannot adapt to breathing outside the womb. Some babies may require intensive care support, including a mechanical ventilator, to increase their oxygen level. If severe, PPHN can result in multiple organ damage, including brain damage and even death. According to clinics in developmental medicine, taking antidepressants while pregnant can also put your baby at risk for developing a cleft palate. A cleft palate is a result of the roof of the mouth not closing all the way. It can interfere with speech, feeding, and breathing. Hearing loss and ear infections are also possible. A cleft palate can have many other effects on a baby's health and development. In conclusion, while antidepressants can help many people feel better, the effects that they can have on an unborn baby are not worth it. Instead of taking antidepressants while pregnant, many women can find meditation and mindfulness helpful in managing their depression. The best thing you can do is talk to your doctor about alternatives to antidepressants. Now, let's take a look at what more serious drugs can do to your unborn baby, like heroin. Heroin can have a devastating effect on babies during pregnancy. Taking heroin is not only extremely dangerous to your own health, but it can be devastating to your growing baby's health also. Heroin can cause a number of very serious conditions. The first major consequence I will tell you about that can occur while taking heroin while pregnant is called placental abortion. According to Substance Abuse Assessment Intervention and Treatment, this is a serious condition in which the placenta separates from the wall of the uterus before birth. Without the placenta, the baby will not be receiving food or oxygen. It can cause very heavy bleeding for the mother and can be deadly for both mother and child. According to WebMD.com, another horrible condition that can affect an unborn baby and its mother from using heroin is called NAS, which stands for neonatal abstinence syndrome. This is when a mother continues to use heroin throughout all of her pregnancy, and the baby also becomes addicted to heroin before it is even born. I'm handing out a chart showing you how many babies are addicted to heroin from birth and the cost of how long a baby would be in a hospital, how much it would cost, and how long they would be in the hospital. And every 25 minutes, a baby is born suffering from opiate withdrawal. The baby then goes through horrible drug withdrawal after it's born. NAS can also cause a baby to have feeding and breathing problems and can cause even seizures. The last major consequence of a woman taking heroin while pregnant that I will tell you about on her baby is sudden infant death syndrome. This is when the death of an infant occurs before the age of 1. Usually there are no symptoms leading up to the death of the infant, and the infant usually passes in their sleep. I have given you all a lot to think about when it comes to what you or someone you love chooses to put something in your body or their body while pregnant, and the negative impact these things can have on your unborn child, from lifelong effects to the death of your child. So if you or someone you know is planning on becoming pregnant, at least make sure you steer clear of drugs and alcohol so you can deliver a happy, healthy baby. Remember, your baby's fate is in your hand, and it's your job to make sure your baby is healthy. I hope you all have learned something here today and can take something positive from my message.